Welcome to the selfgrowth.com show. My name is David Riklan, and I'm the founder of selfgrowth.com. Today, we'll be discussing how caregivers can take better care of themselves. To help us understand this topic, I'm excited to interview Phyllis Quinlan. Make sure to listen closely. We're going to be sharing a lot of information today. Before we get started, I want to just take a couple of minutes and share some information about Phyllis. Phyllis is the president of MFW Consultants, a nurse-owned multi-service consulting firm established in 1994, been around a while. MFW Consultants offers personal coaching, leadership development, healthcare consulting, and training. Phyllis has also practiced as a legal nurse consultant, specializing in defense in New York State and the greater New York area, doing that since 2004. As a transformational coach and positive psychology practitioner, she specializes in the unique needs of nurses and other professional and family caregivers. Really, caregivers are the focus. She's devoted to working with clients struggling with the emotional impact of caregiver fatigue, the challenges of career transition, and those trying to maintain their joy in being a professional caregiver. She specializes in working with healthcare leaders in building and sustaining health work environments. Phyllis is the career coach for the Association of Perioperative Nurses and collaborates with 3M Healthcare in offering professional development and opportunities for nurses across the country. She's sought after as a speaker and lecturer who's known for delivering compelling keynote presentations. She's authored a number of books. I want to share a couple of those with you. One is Rediscovering the Joy of Being a Nurse. Another is The Delicate Balance, a mindful approach to self-care for professional and family caregivers, and bringing shadow behavior into the light of day, understanding and effectively managing bullying and incivility in healthcare. A lot of things she's been involved with. And I suggest you write down her website. She's going to be sharing a lot of information, and the best way to get in touch with her is going to be the website. And it's MFW, so MFWconsultants.com. At this point, I want to jump in. Phyllis, welcome to our show.
Thank you, David. Pleasure to be here.
All right. Well, a lot of stuff we want to cover, so I'm going to jump right in. We're talking about caregivers. So why is it so hard to be a caregiver?
Well, it depends on which type of caregiver you are. So I deal basically with two categories, if you will, of caregiving. The first is your professional caregivers, which are your physicians, your nurses, nurse practitioners, right. Physician assistants, social workers, first responders. You know, when they decided to become caregivers, it really was their choice. They went to school for it. They prepared for it. Many will tell you they decided long ago when they were, perhaps children or even teenagers that this is what they wanted to do with their lives. The piece there is they never foresaw some of the challenges to actually being a caregiver versus being an administrator of a lot of situations. So there are organizational cultures. Some of them are very healthy and some of them are toxic. There is all sorts of government regulations about the model of care and how we're going to pay for it. Right. So you need to know, and perhaps they did not foresee having to work with Medicare, Medicaid, the Affordable Care Act, and Lord knows what comes up next. So they really never never got their arms around the reimbursement pieces. There are tons and tons and tons of codes of federal regulation. It's easier to put together and take apart a nuclear weapon than it is to get through a Department of Health survey. So the agency oversight can be just, formidable. And it certainly then, takes their focus away from their patients, and they wind up having to focus more on paperwork and compliance. And it can be draining. It can be absolutely draining. So they often then, will lose sight of the need for caring for themselves while they're caring for others. That's probably their biggest challenge.
Okay, that makes sense. So those are the professional caregivers.
Right.
How about the people who've taken it on as part of their life? It's a parent, it's a child, it's somebody.
Spouse.
What are some of those challenges?
Right. So, in these situations, the how you got to caregiving was extremely different. Most family caregivers never saw this coming. They never saw having to be a caregiver for a loved one on their path. They rarely have any actual training.
Mhm.
They may know things, they may have learned skills they were taught during discharge planning from a hospital, or maybe in the course of a visiting nurse visit. And they learned as they went, or perhaps they had someone who was a professional caregiver in the family kind of help them with, whatever was needed.
Mhm.
They often have limited understanding of the resources that are available to them. And, things just simple things. We call them simple because I am a nurse, and of course it comes second nature to me, but it's not so simple for a family caregiver to walk them through advanced medical directives,
Right.
healthcare proxies, things of that nature, the need for a will, the need for, all of the legal pieces of having those kind of legal ducks in a row. Many times, more times than you can imagine, they have to put their own lives on hold. Their careers are short-circuited. Either they have to go part-time per diem, or they have to leave their career path altogether. It certainly eats into their savings at this point.
Mhm.
So there's financial struggles that happen. And then ultimately, and I think probably the thing that can be most catastrophic for family caregivers is they become socially isolated, that, you lose contact with your family and your colleagues. And, everybody's goodwill, and they give you the occasional phone call, and maybe you get out to dinner, or maybe somebody comes over and, sits with you for a little while, but it can be truly, truly lonely business being a family caregiver.
I could see that. So I had a little bit of that experience because I was the sandwich generation, older parents, young kids. My sister was probably the primary caregiver, but uh, definitely get a flavor for it. And there's a lot of stresses that go along with it.
Yeah.
So you mentioned some of them as you were going through kind of, and we'll look at caregivers as kind of professional people who've chosen a profession, and people who've taken it on based on something that life has handed them. What are some of the stresses? And you mentioned a few of them. What are some of the other stresses in general being a caregiver?
So again, let's go to the two categories. Being a professional caregiver, even though you go to school and you're training and you do all of this, sometimes you're just not really fully prepared for the fact that, hospitals are 24 hours a day. So it's, when you're going to be a new graduate, and this is
Mhm.
part of what we, sometimes we call reality shock. When you're a new graduate, you can pretty much count on the first couple of 3 years of your career, if not longer, being on the night shift.
Right.
So depending on whether your facility has 8-hour shifts or 12-hour shifts, you could be working, 11 to 7 o'clock in the morning, or 7 in the evening to 7 at night. 7 at night to 7 in the morning, for a number of years. And while we try to mitigate that with 12-hour shifts, so that you're working 3 days a week and off
Right.
4. It's still, it takes its toll, as you can imagine. Trying to balance that kind of schedule, then have a family and a personal life, is also, the challenge of work-life integration can be daunting. And then there is a very, very big push and a lot of emphasis on staying academically up to date. And then, of
Mhm.
course, getting your clinical certifications and making sure you've got your contact hours. So it's rarely just putting in the hours of work. It is putting the hours of work and then continuing school and then continuing certifications. And
Mhm.
if you're in a leadership role, certainly trying to stay at least current with government regulations and agency regulations, if not one step ahead. So the question then begs, when is it their time? When is it time for them?
Mhm.
And the biggest challenge I find for professional caregivers is to get them to acknowledge that they need to put their own oxygen on first, just like the
Right.
airlines tell us every
Mhm.
time.
Makes sense.
It feels so good when you've decided to dedicate your life and your profession to caregiving. It feels so good to care for someone that you often put your own needs last,
Mhm.
and you don't give from the excess of your compassionate nature. You give from the fumes over time, and that can lead to what we call burnout or caregiver fatigue, and that can be a very painful place to be.
I'm sure it makes sense.
Yeah.
So those are for professional. How about people who are taking it on as kind of what we'll decide and we'll call it personal caregivers instead of professional?
Well, the first thing is to come to terms with the reality of that situation. I mean, how many of us, are just living our lives day to day, and not necessarily thinking about the what if the stroke, what if the heart attack, what if the diagnosis of cancer, what if my child is a preemie, what if I give birth to multiples, what if mom has something and now she has to come and live with us, or I'm trying to take care of her in her own home. We go through our day-to-day lives, and you just don't see these things coming. So there is the initial response of denial, of this can't be happening, so there is a struggle to come to terms with what's going on. So I'll use one common example. Mom has a stroke and she's gone to the hospital, they've stabilized her, and now she's in a rehab facility, with perhaps some kind of neurological deficit. It could affect her speech, her swallowing, her ability to move all four limbs, her ability to walk, even her ability to be continent of urine and feces. So, you're trying to wrap your mind around, the reality of this. And then, all of a sudden someone walks in and talks about discharge planning, and you're thinking to yourself, discharge planning? I can't even fathom the fact that mom has survived this, and this is going to be our new reality. So, the second piece of that is, there's some anger involved. You get angry at the reality, you get angry at God, you get angry if this person didn't take good care of themselves, if they smoked and they did things that you knew could put them on high risk for certain things, and then that inevitability happened. You have to get past that. And then finally, slowly but surely, they have to start to dealing with the reality of, well, all right, so we're going to take mom home. What kind of help are you going to offer me? And then here it comes. All right, the reality of the economic downfall of 2007 and 2008, where that type of economic downturn absolutely devastated community-based organizational help. Where prior to 2007, as a former director in long-term care, I might have been able to find some kind of discharge program or some kind of assistance that offered you some type of help 7 days a week. That's no longer the case. Now it's 4 hours, maybe 3 times a week, depending, for a certain amount of time, and everything else is out of pocket.
Right.
So now come to terms with that. So it's and we haven't even talked about the emotional impact of your mom is no longer healthy, and maybe mom's resentful, and now we have to talk about doctor's appointments and where am I going to get this medicine? And oh, by the way, I have a full-time job and 2 kids. So it just comes at you from every direction when you're a family caregiver. And I honestly don't know, knowing the family caregivers I have met over 42 years of nursing, I'm just astounded by their stamina, by their compassion, by their dedication. And, they again are so caught up in the act of caregiving, of doing the best they possibly can, that they rarely think about, how am I going to keep myself whole and healthy and involved and engaged in my life while I'm trying to maximize my loved one's life.
Oh, that makes sense. And there's this sense, I've seen a sense of overwhelm that people experience. It's like, you're treading water, you can't catch your breath. It's like constant. So I know, just as a general rule, when you're in that kind of situation, it's always helpful to get some sort of outside help. And I know one of the things that you do is you provide that. So why would a professional or family giver or family caregiver need the services of someone like you, someone who's a coach and can help them? What's the benefits? Where do you fit in?
Well, first of all, I just want to make the distinction between coaching and therapy, because coaches are trained in the service of being fully present for someone to support them where that person's at. And they are also trained in seeing the person as whole and healthy. Okay, where the services of a therapist would go in a very different direction, and coaches are not licensed to do therapy as such. So if the need for therapy is identified, then they need to go, obviously, for the services of a therapist. But a coach will see the coaching client as whole, but definitely going through the challenges of life, and perhaps engaging in some behaviors that might be less than self-supporting. And they try to help that person remove some blind spots so they can get insights into behaviors that may be self-sabotaging and not allowing them to connect with the fact that they need to take care of themselves first. That's a concept for family
Right.
caregivers. You have to take care of yourself first.
Mhm.
And then you have what it takes to be fully present for the person that you're caring for. So often we get that family caregivers and professional caregivers get that backwards in that, I take care of everybody else first. And then I have, I simply kind of exist on the fumes of what's left over.
Right.
And out of those fumes definitely comes on the darker side of your generous nature for caregiving will come self-sacrifice, will come the resentment and the frustration that self-sacrifice often brings. And then people start to get angry and then they really fall into that pit of burnout. What a coach can do is offer a good set of non-judgmental, neutral ears that are just totally devoted to the caregiver. I am assuming mom's getting great care or whoever's getting great care. And I will listen to some of your concerns about that, but I am focused on you. How are you doing? What have you done for yourself lately?
Mhm.
You tell me that, you've been smoking an awful lot. Let's talk about that. How are you doing with your smoking? Those types of things, and really trying to raise your self-awareness about behaviors that can be supportive and you want to strengthen, and then some behaviors that you might have some blind spots to that are actually undermining your good nature and not serving you in the way they should.
All right. That makes a lot of sense. And getting an outside ear from someone who has experience, they've seen it, they've lived it, can really bring a lot to the table for folks.
And
So,
that's true. That's true. I have been a nurse for 42 years and I was blessed to have parents for a long time. And I was equally blessed, to have a sister who stood with me while we got our parents to a peaceful death and at home. And it was challenging to say the least. And I was a nurse,
right.
I knew how to navigate things. And there were still times that,
Mhm.
the challenges you don't anticipate. You don't anticipate having to have a discussion with your father about taking away his driver's license.
No.
We should all live for that moment. You don't anticipate, again, working with healthcare professionals who may not understand that, your father really doesn't want any more care. When he was 100%,
Mhm.
he made it very clear about what his self-determination was. And you still have to navigate those things.
Sure. Makes sense. So I'd imagine there's a lot of challenges with working with caregivers. So what are some of the challenges that you see to working with caregivers?
Well, regardless of whether they're professional or family caregivers, the number one challenge is to get them to accept that they need help, that they need support. It's
Mhm.
not that they're broken. It's not that they're damaged. It's just that they're very good people who are leaving it all on the field and really deserve to have someone supporting, totally devoted to them.
Mhm.
That's what a good coach will do. All right. They listen, they offer suggestions if that's invited to. We often ask, well, do you want my insight into that? But we don't preach, and we really try to help you access all of the answers that are inside of you for yourself. So sometimes that involves raising your awareness about emotional intelligence,
Mhm.
trying to navigate a few emotions that trigger you to act in a manner that you wouldn't really want to, or say things that you're going to regret later. We use the tools of applied positive psychology to help create a more positive outlook on life, so people don't feel victimized, but they're more empowered to do
Mhm.
what they need to do day to day. So it's things like that you might be able to also make suggestions about
Mhm.
resources and steer people, family caregivers, into resources, and then work with professional caregivers, especially the leadership division of professional caregiving, into creating healthier work environments that would support the caregiver's work, even though the reality of these regulatory agencies and
Mhm.
electronic medical records and having to do more with less, are things that will not go away. It just helps you gain the inner strength
Mhm.
so that the stress may be the same and even more, but you are better prepared to manage that strength day to day and not feel so exhausted at that end of the day.
Right. What's interesting is that I think a lot of people inherently, they know they need help. They're struggling. It's difficult, but it's a matter of prioritizing. And if they continue to make other people their priority over them, which I think is what happens for a lot of people, it's going to catch up with you. You're going to get burnt out. And I think people need to realize, you're saying, the whole analogy of, put the oxygen mask on first.
Mm-hmm.
If you want to serve people, whoever it is you want to serve, you need to be taking care of yourself. And it sounds like the same thing in terms of making a decision, whether you need someone to work with. That, yes, I need some outside help to do that. So I get that as kind of a first challenge.
It is a first challenge. And, when it comes to family caregiving, and especially if the caregiving role is kind of creeping up on you, you're anticipating becoming more and more involved as a family caregiver, because now mom's living alone. She's retired. She's got a little bit of this and a little bit of that. And all of a sudden you realize that she might be struggling a little bit with some memory loss, but she's still not completely, but perhaps very functional. So, she wants to live on her own, and rightly so. And the stress is really like you're waiting for the other shoe to drop. What am I going to do if? What am I going to do when mom does? What if mom falls? And then, of course, we can certainly offer support and offer care. That doesn't mean that the person that you are trying to care for is accepting of that care. And, they're depending on the relationship that people have had as they were growing up, the dynamics of the families, that always adds an extra layer. Not everybody sees your desire to be supportive as good-natured benevolence. Sometimes they see it as interference or disrespect, and you're struggling with that. And, it sounds like there's a real no-win scenario here, and very little, pros. It's extremely challenging. And again, to be able to sit with a coach and sort through some of those feelings so that they don't stack on you and they don't distance you from your compassionate nature is often very helpful.
Right. Can you take us through the coaching process? How does coaching work? Is there a set process that you typically use when you're working with people? Sure.
So, coaching is voluntary. All right. So, you're going to reach out to the coach, whether that coach is, in a healthcare organization coaching the staff, or whether, they're a private coach and professional caregivers are seeking their services. So coaching is voluntary, and coaching is driven by the person being coached. So there's no prescriptive there. There is nothing that says, well, here's the methodology. That's a one size fits all. Coaching is very flexible and fluid, and it's customized for what that person needs. So perhaps someone needs to, every other week, they just need to sit and have a cup of coffee and Zoom with someone or be on the phone with someone and just, let it all out. They decide, the person being coached decides, what are we going to talk about? They decide how often those sessions are going to happen, the length of those sessions, and really when the sessions are done, with the option of, if I want to call you next year, can I? So it is really a client-driven process. And, there is some goals that are usually discussed in the beginning. Why did you seek the services of a coach, and what are you hoping to get out of it? And the coach does have a responsibility to keep bringing those goals up every now and then, especially if they see the process straying off that. Right. And just to not necessarily, say, are we going to, we're drifting off, you stated this goal and we're deviating from that, but to say to the person being coached, so I remember you saying this was one of your goals. Has that changed? Because again, it's driven by the person being coached.
All right. Now, for people who are listening, can you share your website again for people who want to get in touch with you, get more information?
Sure. So my website is M as in Michael, F as in Frank, W as in William, mfwconsultants.com. And you can go to my website. And I also invite you to go to my website and go to the homepage and then click on any of the icons that are there to follow me on my social media sites. So I am on Facebook, I am on Tumblr, Instagram, Twitter, and I have a YouTube channel. And I post every morning on my Instagram channel, which is the @ sign, ask, ASK, Dr. Phyllis, DR Phyllis. And I post a daily dose of resilience message for all of my followers to kind of get them to positively start their day.
I like it. So relative to coaching, what are some of the common reasons? And I think you talked about some of them, but what are the primary reasons why caregivers are going to seek out your services?
Unfortunately, it's because the wheels have started to come off. Okay. And that's usually the primary reason. Their backs are up against the wall. And as I shared with you, caregivers are reluctant to put their own needs first and seek care for themselves. So it's usually when they start to feel that their personal life is starting to crash and burn. Perhaps if they're professional caregivers, their career has gone off track. And if they're family caregivers who have been able to keep their career, there's definitely some feedback from individuals who they report to that, you're showing up a little bit tired. We see the stress and strain, or perhaps they're getting feedback from friends and family that, we see your energy and it's really starting to take a toll. So hopefully before there is an ultimate crash and burn type of situation, they would say to themselves, I'm worthy of this. And I really want to share this piece, David. When you have the generosity of heart to step up to be a caregiver, whether you choose that for your life and profession as a professional caregiver, or you meet the challenges that the universe puts on your path that you never saw coming, when you are the type of soul that can step up and say, yes, I will, and yes, I can, and then deliver on those promises, you're an extraordinary individual who deserves to be cared for, to always have somebody in their corner to remind them of their worth, their value, to help keep their spirit whole. And for any kind of caregiver, professional or family caregiver, to lose connection with just how extraordinary they are is really a sin. So that's really the mission I have with my coaching practice.
All right. Well, one of the ways I've seen people mention this to me before, it's almost like it's a gift that they're giving themselves.
It's exactly right.
They know they need the help, and it's always, how can I help? How can I help someone else? What I need to do for somebody else? And at times you need to take care of yourself, and it's a gift that you're giving yourself. So I just want to urge folks, if you're at that point, the stress is there, some of the challenges, it's definitely worth reaching out to Phyllis, find out how she can help. What are some of the things that she can do? So what are some of the tools that coaches use? You talked a little bit about the process. Are there some specific tools that you use when working with clients?
There are. You'd want to pick a coach who is certified in what they're doing. So they're not doing coaching by Bob, so to speak. You know what I mean? That they actually went to school and went through a multiple month or year-long process of learning, fundamental coaching techniques. That's number one. Number two is some of the tools that we use. I specifically lean into the competencies of emotional intelligence. So there are 4 competencies for that: to be self-aware, which is the gateway competency and probably the most difficult competency to master, to really know yourself, to know what triggers you and what sustains you. Self-management, how to respond when you're triggered in a manner that you would be proud of and happy with. And then there are social awarenesses, how to act in groups. And then relationship management. How do you keep your relationships working? And a lot of times we talk about a lot of relationship management because inevitably there is this old story that one woman can give birth to 6 kids, but 6 kids cannot take care of one woman. So that you find yourself as the designated caregiver and you've got these siblings and, everybody's busy, everybody's this, and no one's stepping up like you are. So how do you keep those relationships alive if you choose to? That's a skill that a lot of times family caregivers really need to work on. So that's part of it. The other piece is applied positive psychology. And I think that probably the biggest 2 tools that I offer for that is really a practice of gratitude. And, even on your darkest day, there is something to be grateful for. Even if it's only that you acknowledge you had the generosity of heart to step up and do the work. And And that's so important because we're wired for negativity. Our fight and flight and our sense of survival makes us see the negative in things. And, like I say, waiting for the other shoe to drop, or, you start to think negatively before you would think positively. So working with someone to develop a positive attitude, a positive mindset, see the grateful. And, it's funny when you start, thinking about and acknowledging things that you're grateful for, more things to be grateful for show up in your life. And I also teach mindfulness. So that is one great way I feel that people can use to kind of settle themselves. To be able to have a mindful moment. You don't have to sit on a chair or a cushion on a floor, or be in a temple to meditate or to practice mindfulness. You can actually just sit at your kitchen table and learn how to take a couple of deep breaths that then work with your body to slow everything down, so that in a moment when you feel like you're at the edge of things and you just looking for some relief, you can bring all of your physiological pieces down and quiet your blood pressure, your breathing, your heart rate. And then because that epinephrine is no longer surging through your body, you can start to see things more clearly. So these are great tools that people can be taught how to access themselves. And again, coaching is not talking about how broken you are. Coaching is talking about where do we get you so that you are so empowered that you feel as though you no longer need the services of a coach. It's all about empowerment.
Well, the three areas you mentioned, emotional intelligence, the applied positive psychology, and mindfulness, what I like about all three of those is also a lot of science behind
Yes.
the effectiveness of those tools and where they work. So I like the fact that you're incorporating those while you're working with people.
Yeah, the science is robust. In fact, many of the schools of medicine now, especially I think it's Harvard School of Medicine, Massachusetts General Hospital, they all have divisions now of mindfulness. John Kabat-Zinn, who is one of the leaders in mindfulness training, is up in Massachusetts leading a whole institute for that. We're starting to, some of the regulatory agencies are now actually realizing that burnout is an issue with professional caregivers. And of course, we have all the issues with, post-traumatic stress and dealing with things. So they're starting to say, well, if we're going to keep a healthy workforce in healthcare, maybe we need to start offering them these kinds of tools and maybe even the coaches to help them get there.
All right. Can you touch a little bit? So emotional intelligence is an interesting topic category. One of the things that it does, it helps build resilience. And resilience is really important, especially under the stress for caregivers. Can you elaborate a bit more on how developing emotional intelligence really helps build resilience?
Yeah. So I think the key competency of emotional intelligence, which is the first one, self-awareness, it's the most difficult competency to master, but if you can start to get your arms around it, so many other things fall into place. So, many of us, and especially when you're stressed, you do things and you say things that under other circumstances you would have more self-control not to. So when we say is that you've been triggered by an emotion, triggered to respond in a way, and often, maybe react in a way is a better word. So, you've been hours trying to get on a phone to a provider and then you get on the phone and you find out you can't get an appointment for a month, and now you lose it, It really depletes you when you respond inappropriately and then have anger, remorse, or regret following that. Then the situation is still there and you feel that much more drained because you have responded in a manner that is depleting and not empowering. When you work with self-awareness, you become aware of things that trigger you so that going into this. For instance, when I used to have to try to get my dad's meds at the VA, every month I would have to call to make sure he got the next month's package of his medications from the VA. If you've ever gotten on the phone with the VA, it can be a torment. Okay. Yeah. So in the beginning, I would get angry and then I would realize, well, this is not changing. Okay. So the only thing that can change is me. So leaning into my self-awareness, I would be that much more willing to say, okay, I've got to talk to the VA. Let me get things off my desk. Let me get a sandwich. Let me get a cup of coffee. I'm going to sit here. I'm going to be playing the VA game. And it was the way that I self-managed myself so that things didn't torment me and deplete me. And then when I was finished jumping through those hoops, I could go on with the rest of my day, not feeling like I had to lay down because I just left it all on the phone. So self-awareness, really helps you discover where do your emotions lead you or mislead you? Where are your frustrations, and are there better ways around them? Are you, instead of getting angry at souls, maybe it's time to build those relationships. And it really makes you aware, and that training can also help you get the tools to be able to quiet yourself, think through a situation as opposed to feel through a situation. So again, that you're feeling empowered and not depleted.
Right. And I would imagine in control versus out of control.
Right. And I'll be very honest with you, I have met very few professional and or family caregivers that aren't somewhat control freaks. They have to be. The amount of responsibility and accountability that is on their shoulders is crushing. Sure. So when you say to them, well, you're such a control freak, you should say thank you, because they're really keeping all the plates in the air. And no one else is stepping up to take a plate. You know what I mean? So if I'm a little controlling, you're welcome. I'm taking care of this one, I'm taking care of that one, or I'm doing whatever. So there's a piece about being controlling, and there's a piece about then being out of control. And really the self-awareness reduces the risk that you're going to feel out of control, which is not only disappointing, but depleting. It just makes you feel like you can't do anything right. And again, these are souls who are so wonderful, so generous, so caring, and they should be, really held up there for everyone to see and be grateful for.
All right. I want to touch on a different topic. I know you also work with healthcare leaders in creating healthy workplaces. Can you tell us just a little bit about what you do there?
So, we talked in the beginning about professional caregivers and never expecting to see how political healthcare organizations can be. The amount of rules and regulations, trying to work with an electronic medical record. I think if every one of us could pick up that computer and throw it out a window, we would take that advantage of that opportunity. And of course there are interprofessional teams. So, are the doctors and the nurses working well? Is pharmacy serving, are the social workers feeling like they're the forgotten caregiver? There are all bits and pieces of the dynamics that happen within an organization. What I really like to do is work with healthcare leaders to take a good look at, in a positive way, what's going on in either their individual units or their individual departments. So in creating a healthy work environment, you want to look at the pillars of what creates a healthy work environment. And then you want to take a positive psychology approach, which is known as appreciative inquiry, to do a drill down on some of those elements. So for instance, one of the key elements of a healthy work environment is to have skilled communication. So if you get a group of people in a room, the end users, the people the staff in your unit, and you talk about what's working well with our communication, you'll find, probably surprisingly, that a lot is working well. And then you say to them, well, if you had a dream, what would communication in this particular unit or division look like? Right. And people will tell you. And really then the last piece is then, well, what's holding us back from that dream? And that conversation then will probably identify barriers and people that are standing in the way of living the dream of communication on a particular unit. When you identify the people and the barriers, that's really your action plan. And you can start to then chip away at those things, because that column is really undermining the resilience of your team. When systems don't work, when relationships don't work, it makes an already difficult profession harder. And that's when people really, you'll hear them all the time, if I could just take care of my patients, this would be fine. Right. But I have to do this and I have to do that, and the meds don't come, and this happened, and blah, blah, blah. And it's just, it takes up so much of your day. And meanwhile, everybody's in your ear with, did you spend time with your patient? Did you spend time with your patient? And you're thinking, what time? I've been trying to do this. I've been trying to do that. So the more healthy the work environment, meaning taking the pebbles out of the shoe, making sure that systems work the way they're supposed to, and people aren't creating workarounds, that relationships and partnerships work the way they're supposed to, that there's a healthy respect for the interprofessional team the way it was meant to be, so that people have a collegial, manner towards each other, as opposed to, gotcha, or, one-upsmanships, or who's to blame, or, all of that. And then probably one of the bigger things that gets overlooked, although fortunately it's now starting to come into the light of day, is the shadow behavior of disruptive behavior, which really comes down to bullying and chronic incivility in the workplace. We really have to make a concerted effort for our professional caregivers to create a healthy work environment where incivility is dealt with. And either people can choose to be civil or they can leave. If you want to be a citizen of this organization, you have to act accordingly. And then managing bullying behavior, because no one has the right to make another person feel abused. And we haven't really, because it's a shadow behavior, as I call it, it doesn't come out into the light of day. We've kind of turned a blind eye to it and called it, well, they have a few strong personalities on that unit. And usually when I hear that, I'm like, okay, you either have one bully and a couple of uncivil people, or you have totally uncivil people. But we have to deal with those people. They either have to see the light of what good, healthy work behavior is, or they have to go, because the rest of the people who are showing up ready, willing, and able to do the work of the day cannot be distracted from the work of caring for those patients. And that's what's happening. That kind of distraction, trying to work with chronic incivility or bullying, creates a distraction that then may lead to an error. And oh my God, if that happens, then the person trying to do the right thing is just crushed by the inevitability and the consequences of that.
Yeah, makes sense. So we've covered a lot of material today in a lot of areas. So, and I know there's a lot of things that you do. We talked about some of the books. Obviously, you work with either professional caregivers, people who are doing it as part of their family, caregivers. Can you give a quick overview first, if you can share the website again, and then talk a little bit about what services you provide and what products, how you work with people to help caregivers?
Sure. So the website again is MFW, Michael Frank William, mfwconsultants.com. And you can go onto my website and you can see the services that I offer. So I offer conventional coaching, and I offer coaching that can be supplemented with Eastern philosophical approaches, such as energy healing and things of that nature. I have, if you go to the store tab, you can see what my fees are, and you can decide to have a one-time coaching session with me, or you can purchase a package of coaching sessions. And there are indeed special prices for the nurses who belong to the Perioperative Nurses Association, because I am their career coach. But you can also see the other things that are there. I'd like to just make a plug for an organization that I am on the board of directors of for the family caregivers, David, if I could. Sure. And the name of that organization is Share the Care Organization. And Share the Care is a not-for-profit organization and there's a book, Share the Care, that can be bought on Amazon. And that book really helps friends of families who are family caregivers. You're seeing your family caregiver kind of like, melting under the stress of being a family caregiver. This book will walk you through the steps of being able to create a supportive care group around that family caregiver. And it can really be a make or break situation of support. So as a member of the board of directors of that organization, I wanted to share that with your listeners.
Okay, sounds good. We've covered a lot of material today, and obviously you bring a lot to the table for people. So I want to urge people to get in touch with Phyllis. You have her website, take a look at what she's doing, check her out, contact her. Before we finish up, any final words, any final thoughts for people? Obviously, we have caregivers, both professional, non-professional. Any final words for our audience before we finish up?
I really just want every caregiver out there, whether you are a professional or family caregiver, to really do what it takes to acknowledge the fact that you are such special, generous people, and that it needs to be honored and cared for, and that you are worthy of caring for yourself. And in fact, if this is what's on your plate and you are stepping up to it, it becomes part of your responsibility to take good care of yourself so that you can continue to do the generous work that you do.
All right. That's a great message. All right, Phyllis, thank you for joining us today, sharing.
I appreciate the opportunity.
All right. And I'd also like to thank everybody for listening, and I wish everybody great success in all areas of your life. We'll talk to everybody soon.
Bye-bye.
Bye-bye.